Our next presenter is Mikaela Baril. She is going to talk about, she's our last presenter on a psychiatric disorder. She's going to be talking about major depressive disorder, and she is mentored by me. Thank you.
Hi guys. I apologize for a little bit of sniffling. The pollen from the dandelions is attacking my sinuses. My presentation is on major depressive disorder. Major depressive disorder is a mood disorder that interferes with daily tasks such as sleep, concentration, and decision making. It is the most common of mood disorders, and it is also the most severe. This is long-term. This isn't just a short bout of sadness or everyday sadness. This is very long-term, and people who are experiencing major depressive disorder can have multiple episodes where they are feeling depressed or down, or they can also have just one episode. Some statistics are that women are 2 times more likely to have major depressive disorder compared to men. This may be due to gender discrimination or a lower economic status due to their standing in economics. And approximately 7 million people in the United States suffer from major depressive disorder. There are biological causes and environmental causes. Certain types of depression can run in the genetics of the family. Also, major depressive disorder can be caused by everyday stressors like school and work. It can be caused by trauma, abuse, bad relationships, a death in the family, and also there is not always a clear cause. So while some people may be experiencing major depressive disorder because someone close to them passed away or because they're having a heavy amount of stress on their life, there's sometimes people just fall into bouts of depression and there may not always be a reason. Some signs and symptoms, they differ from person to person, and some symptoms are more severe, some are less severe, and not every person will feel all the same symptoms. Some of those are eating and sleeping problems. Either they eat more or eat less, sleep more, sleep less. They can have sudden anxiety, sadness, helplessness, hopelessness are just some of the basic signs and symptoms that we see every day. There are 2 main types of treatment. There's pharmacotherapy, which is medication, and then there's psychotherapy, which is counseling and therapy. The first type of medication I'm going to talk about is SSRIs and SNRIs, and these are medications such as Prozac and Cymbalta. They can cause side effects such as nausea and headaches, and what these medications do is they target the neurotransmitters inside of the brain to help regulate mood. The next type of medication is TCAs, or tricyclic antidepressants. These are older, but they do about the same thing as SSRIs, where they target the neurotransmitters. They are used less often because there's a higher risk of injury due to the different side effects. Some of those side effects are constipation, dry mouth, and dizziness, which is where the risk of injury comes into play. Another form of antidepressants are monoamine oxidase inhibitors, or MAOIs. They increase the amount of neurotransmitters in the brains, in the brain, not multiple brains. These are used less often because the risks are, there are higher risks of interactions with other medications and risks when combined with certain foods or drinks like matured cheeses, yeast and protein extracts, beer, banana chips and banana peels, and multiple other foods and drinks. Some of the side effects of these are drowsiness, weight gain, and insomnia. The other form of treatment is psychotherapy. There's cognitive behavioral therapy, which helps restructure the negative thoughts in a person's brain. So if they're feeling sad, they'll talk to their therapist about it, or having suicidal thoughts, or feeling down on themselves, they can talk about it and help make them feel a little bit better about themselves. There's also interpersonal therapy, which helps the person affected by depression identify the troubling relationships or other triggers in their life and kind of help resolve those issues. And then another form of psychotherapy is the Humanistic Therapy approach, which helps the person affected with figuring out their maximum potential and self-determination and self-worth. Psychotherapy is generally for mild types of depression. With more severe types of depression, psychotherapy is used in conjunction with medication. When these two methods fail, there's the use of electroconvulsive shock therapy. This is a type of therapy that this is used when traditional types of therapy, medication, and they don't work. The treatments are administered to the patient 3 to 4 times a week. They put the patient under anesthesia and they send electroshocks to their brain. They induce a seizure, and this doesn't cause any pain or discomfort to the patient except for the side effects, which are like dizziness and loss of memory. This works by altering the neurotransmitters in their brain or by altering hormones and the chemistry within the brain. It is not exactly found how exactly the electric impulses help restructure and help major depressive disorder, but it works, and there are various cases showing the positive effects of this. Psychotherapy, primarily cognitive behavioral therapy, is used to treat major depressive disorder in children. The cognitive behavioral therapy can also help determine whether or not the child will need any more type of treatment, which would be medication. And if the child affected needs medication, they're generally prescribed an SSRI. Suicide is the second leading cause of death in the United States, especially in teens and young adults, and primarily in people that are affected by major depressive disorder or bipolar disorder or other mental disorders. Suicide can be prevented by identifying warning signs such as drug use or withdrawing from friends and family, talking about their sadness, they may try to reach out or discuss that they're feeling helpless or worthless, or describing their symptoms to friends and family. Suicide can also be prevented by just talking to the person, figuring out what's bothering them. And then also cognitive behavioral therapy, of course, will help the person if they're considering suicide. Another option is the National Suicide Prevention Hotline. I have the number listed over here. It is also a website that helps someone that is considering committing suicide. You can call that number, or if you have someone close to you that is considering suicide, you can also call this number to help find out what you can do for the person, what they can do for themselves, or how to approach the person and not just catch them off guard and make them nervous about it. The website shows other warning signs of someone considering suicide. It's more in-depth, and it can tell you what to do. And that concludes my presentation.
Questions from Mikaela?
Yes?
So what's the difference between like major depressive disorder versus chronic depression?
Major depressive disorder is one of the more severe forms of depression, whereas like clinical depression is more not as severe. I'm sorry, I don't know the exact words. Yes?
So, if my understanding is men are way more likely to commit suicide compared to women. So do you think that that has like, there's a correlation between men not seeking out the diagnosis, or is suicide in men more likely caused by other factors?
I haven't exactly found the statistics of suicide in men compared to suicide in women with major depressive disorder. It may be that women are more likely to seek out help, and which is why they are less likely to commit suicide, but that is something that I would want to research myself.
Right.
Over here?
It's sort of two parts. Is there a certain type of treatment you think works best? And do you think electroconvulsive therapy is unethical in a way? Or
Do you think what is unethical?
electroconvulsive therapy?
I don't think, I'll start with the second question because it's off the top of my head. I don't think electroconvulsive therapy is unethical. It is definitely portrayed in media to be, but it is not the way it is portrayed in movies. I don't know if you've seen American Horror Story Asylum, but that is not how it works. I believe probably it depends from person to person which type of treatment is the best. I know that a few years ago I had clinical depression, and I did not use any medication. I did cognitive behavioral therapy, and that very much helped with my issues. Just talking it out seemed to work for me, but some people have more severe cases where behavioral therapy or other types of therapy may not work as well, and they may need other medications to help kind of change the structure of their brain and neurotransmitters, which talking can't really change that. Any other questions? No? Okay, well, thank you.